Hi everyone, my name is Connie Alexander and I'm the Senior Manager of Primary Research and Insights here at Allegion. Throughout the last 6 months, Allegion has worked on peeling back the curtain in the healthcare market to better understand the trends and challenges in today's facilities. As part of this effort, we conducted surveys with key decision makers at hospitals across the United States. And it's interesting to see ways the industry has changed over the past 5 years to meet the evolving needs of today's patients and healthcare workers. And I've conducted healthcare research for more than 20 years and have never seen such robust shifts. So we were curious to see how the COVID-19 pandemic reshaped healthcare, and what we found goes far beyond PPE and touchless access control to include new uses for electronic access control. We're excited to share with you our research findings, the changing landscape of the healthcare, and some of our key takeaways. So let's get started. Clearly, no one could have predicted the profound and ongoing impact of the COVID-19 pandemic. In fact, we found nearly 9 in 10 healthcare professionals that we surveyed cited at least one way the COVID-19 pandemic had impacted their organization's infrastructure, needs, and plans. Plans and projects were paused at nearly a quarter of the organization's surveys. Budgets and priorities also shifted for many of those professionals. Unsurprisingly, infection control measures changed at hospitals as they adopted new ways to reduce the surface transmission of viruses from touchless access to antimicrobials. We found 73% are now using surface technologies now more than before the pandemic, and another 15% say they are using those technologies to the same extent as before the pandemic. Additionally, 61% of those surveyed are now using hands-free or touchless products more than before COVID-19. I cannot begin to cover all the information on the influence of the COVID-19 pandemic in this brief overview, so I encourage you to watch our video that deep dives into this or read the full findings in our ebook. Allegion's research also looked into other key trends within the market, identifying strategic initiatives in place today and what's being planned for the future. Looking ahead, we should expect to see security-related initiatives grow in the next 12 months. 40% of hospitals plan to expand their security plans before the end of this year, and these plans might include improving key control, upgrading credentialing, and even adding more ligature-resistant hardware. Another initiative several hospitals are planning to adopt this year is building automation solutions. The increase in this has grown notably over the last 5 years. Electronics are also on the rise in hospitals, especially in larger urban markets. We found over 90% of hospital facilities are using electronic access control, which is actually up 10% from 5 years ago. Increased interest in electronics is likely driven by many factors, including the need to control and restrict access during the pandemic, the desire for contact tracing, which may become easier with electronic locks and readers, and finally, interest in collecting data for building and device optimization. Additionally, our research found hospitals are becoming more accommodating for people of all abilities. More than 80% of those surveyed had updated doors to meet ADA compliance, primarily to mitigate risk and meet codes. Lastly, hospitals are also adapting to the growing need for safe spaces for behavioral health patients. This has increased in the last 5 years and is driven largely by the psychological and sociological impacts of an ongoing pandemic, as well as the influx of these patients through emergency rooms. For more of our findings, please take a moment to dive into Allegion's 2022 Healthcare Trends Report by visiting the website on your screen right now. Thank you.